Hello, I'm Dr. Pravir Basu, consultant neurologist and a mental health expert. And today I'm going to talk about a new thing. Many of you young people who have come to me in my outpatient department with scrotal pain, and when I've ordered him to do an ultrasound of the scrotum, they have showed that they have something like the scrotal pearls or testicular microlithiasis, testicular microstones. Now, many of these people are anxious and they ask me whether these are precursors for cancer, testicular cancer or not, because they often go to the Google and they search the Google and they find that these small calcifications can cause malignancy in the long term. So I have built this video in to just allay all this anxiety, all these fears, because nowadays, previously we didn't have there's so many of testicle ultrasounds being done, but today, with more awareness, with more people opening up, we're doing a lot of these testicle ultrasounds with Doppler and all these things. So a lot of these young people, young adolescents and people on the 25, 26, 20s mainly are coming up with this problem. They're basically unmarried people and they are much more concerned with their sexuality, and they're often very fearful when they come. So I want to tell you a few things, a few basic things. You don't have to be worried. You don't have to be so much anxious if you find that you have having this testicular microlithiasis on your ultrasound report. Um, Let me share my screen. Okay, let me go to my whiteboard so I will be able to tell you much better. Okay, so okay, fine. Now let me use my pen. Where is my pen gone? Yeah, this one. Okay, so I will tell you one thing very simple is suppose I'm sorry, let me go with this one, right? Suppose this is, as we know, is the scrotum and the testis forms a part of it. Okay, so there's often something called the epididymis. Okay, epididymis. So epididymis are basically these are paratesticular organs. Okay, what really happens is all these epididymis these epididymis actually transfers the sperm, transfer the sperm to the urethra where there's ejaculated. Okay, so basically this is an epididymis and it often gets thickened sometimes. So there may be epididymal nodule or epididymitis or epididymal can be palpable per se. So often these people get anxious when they feel that there's some sort of other swelling other than their testes, their own testes. So often there's normal epididymal thickening, right? Now, now testicular microlithiasis or testicular stones or testicular pearls, whatever you say, these are basically ultrasound findings. So we are not able to palpate these per se. This is take it to very this is very important. Okay, you cannot palpate a testicular calcification, right? These are basically ultrasound features, and ultrasound features means though these do not cause any pain, these do not cause any swelling on the testis per se. So on the ultrasound, you may see there's a lot of this multiple tiny echogenic. You know what is echogenic? When you see the X-ray plate, these are appearance as white specks, and there is no shadowing behind. Okay, stones have this shadowing because ultrasound, no, ultrasound is any energy. Okay, and when there is a major obstacle, suppose a big stone, so this ultrasound cannot go over here, so it forms an acoustic shadow. Such shadows are absent when we're talking about testicular microlithiasis. Now, these small calcification may be anywhere between 5 to 50. Okay, between 5 to 50 in one testis. Now, it is very important to note that there are two types of microcalcifications. Okay, one can be what is known as what is known as disorganized or randomly assigned microcalcifications. They are present on all sides. So 5 to 50, any number throughout the testis. But what is most concerning is the cluster of microcalcification. Suppose on an ultrasound, if you see this part of the testis has a cluster of the small okay of microcalcification, and the rest part of the testis is normal, then there is a chance that there may be a dysgenic area. What is a dysgenic area? That is, there will be an abnormal area of that portion of the testis, which can, I'm not saying always, which can give rise to some pre-malignant condition of the testis. So if you have a cluster of microcalcification in one spot of the testis and the rest of the testis appears totally normal, there's no calcification, then that is a source of worry. Okay, then that is the source of. Otherwise, you don't have to worry at all. So even if you have this ultrasound plate, you can talk with the doctor whether it's a cluster calcification or a generalized microcalcification. Now, this is a very important thing I want to tell you. This there's have been a lot of research papers have been done over the years. Okay, there's a lot of research articles have been done, and they say that testicular microcalcification, see, you don't have to worry about that you are harboring any testicular malignancy or going to have testicular malignancy in 5 to 10 years of time. But if there is any history of testicular maldescent, okay, we will find these all this what is testicular maldescent and everything in my coaching, proper coaching, which I do on online basis. And I will send you the link of my course materials also. What is a testicular maldescent? Now you have to understand that testis is actually in when we are in the embryonal stage, is not actually in our scrotum. It went from above to downwards. Okay, so the descent of the testis, if it is stopped at any point of time, people do come with testis in their abdomen. Okay, so there is some problem in the embryological period that the testis doesn't come normally down into the scrotum. So over there, if a person has an undescended testis or had a surgery done in his childhood to correct this undescended testis, if he has a small testis, okay, it's called an infantile testis, very small testis, or if he has a first degree relative, that is father or brother, who had suffered from a testicular tumor, then in a person, if he has a testicular microcalcification, will need proper evaluation to know whether he will be suffering from testicular malignancy in future. That is a very big issue. Okay, other than this, I will come to the next topic, subtopic of today's discussion. Is this testicular microcalcification can cause what is known as the diminished fertility. Okay, there's something called the as you can understand, there's something called let me stop the share and I'll tell you, go in your face. So there's something called the erectile dysfunction, something called the infertility. Okay, infertility is the person is not able to be a father even after a long time, even after the marriage. So it's called the infertility. What is a subfertility? Something called a subfertility. Subfertility is he's able to become a father, but he has taken multiple. He needs a. It's that his semen parameters is not up to the level. Due to semen analysis, he's been suffering from infertility for quite some time. And check his semen has something wrong. The sperms are not up to the number is not up to the level, or the motility of the sperm are not up to. Again, a lot of confusing stuff over here I'm going to talk about, but this is very well elucidated in my course material. So obviously the link I have given in this comment section. So what I mean to say is, let me share the screen again. Is There's a whiteboard. See that when you examine the testicular microlith per se on an electron microscope, and the researchers have done, they have found it has a central calcified area. It has a second layer of, you can say, collagen material, but a third layer is derived from the lining of the seminiferous tubules. Now, what is seminiferous tubules? Again, testis has two components. Okay, one is the component which produces the testosterone, the male hormone, which is known as the Leydig cell. Okay, and the second component is the one which produces the spermatozoa, which is the gamete. Okay, the male gametes, and these are produced by the produced basically by the seminiferous tubules. Now, this layer of seminiferous tubules is being created in the outer layer. That means there's some amount of seminiferous tubules which are supposed to produce the spermatozoa are being turned to produce this lining. So there will be some disturbances in spermatozoa formation. Okay, so there has been found that there will be a decrease in the number of spermatozoa one, or there may be a decrease in the motility. That's the movement of the forward movement of this model. No, the sperm swims so that during the fertilization period. So these two, if they form, this is known as a subfertility. Okay, so this is not totally absent, but it is an abnormal, that is aberration from the normal. If sub Now we know subfertility is one of the risk factors of testicular tumor. Okay. Now, if this patient has subfertility and has testicular microlithiasis that is not only clustered, involving both the testes, then he becomes a risk factor for testicular tumor in his future. So the purpose of this video, my dear friend, is not to scare you. It's not to scare you. It's one. I want to make you allay this anxiety that if you find a testicular microlithiasis in your ultrasound report, 90 to 95% chances you just forget about it. Don't forget about it, because nowadays we do tell you to do an annual check ultrasound and do a monthly testicular self examination, because the first and the earliest stigma, or you can say the sign of or symptom of testicular tumor, is actually picked up by the patient himself if he does a normal testicular self examination, just akin to a normal breast self examination we advocate to the females, to the females. So there has been movement, a lot of movements are there about breast examination, but not much movement has been there towards testicular self examination. So most of these patients now, when they turn up, they then later tell us that, Dr. Saab, if we had this concept known to us, and we could have picked it up much earlier, because these patients present very late, hard form testes, and then the tumor has already crossed the limit. Okay, so that is a very important topic I want to tell you. So these are the few risk factors. So basically, risk factors needs more comprehensive assessment. Talk with your urologist, and even if that you don't have any other risk factors, as I mentioned, then even then you have a annual visit to your urologist and do this monthly testicular self exam. If you find this video helpful, do comment, and I will be more than happy to reply to your comments. Okay, till then, stay safe, and I will be back again with another video. Bye bye.